So currently in Nasser Hospital ITU. About 20 minutes ago, the hospital was hit above the emergency department, second floor. We heard an enormous explosion and the entire hospital rattled. So we were told it was hit by a missile. We don't know. That's what we've been told. But the second floor is on fire, and we're taking shelter in the intensive care unit with the double wall rule. So we have two critical patients that we were just about to bring back to the OR for bleeding internally. One was a transfer in, one was a case from earlier on. So we have a lot of vulnerable patients in the ICU as well, and we're waiting for our security to give us the go-ahead. We're not sure what's going to happen. Maybe we'll be evacuating. So it's the early hours of Monday, 24th of March. On the evening of 23rd, Sunday, we were in the ICU department at Nasser Hospital on the 4th floor. We had two very critically ill patients who were bleeding from wounds from earlier in the day, from shrapnel, from blasts, and we were debating which one to take back to the operating room first when we heard a very loud explosion and the entire floor vibrated and rocked slightly. And it was only then we heard the panic that there was a hit on the actual hospital, which turned out to be a hit on the second floor male department, the surgical department, where we have a lot of our patients staying post surgery, and some people were killed. You giving me a high five? Video? Yeah, good man. You alright? What's he saying? Let's go home?
Yes.
Foot looks great.
He's asking, I want to go home.
Yeah. Do you know if his parents are alive?
كيف حاله? No, his family, his mother is injured. She is in the female surgical ward.
Yes.
Yes.
Alright.
Also, he lost his siblings.
Lost one.
I don't know, many of his siblings. He's the only living kid for his parents. His mother is injured and his father is fine.
It's been a very eventful 24 hours. Just walking through ICU now. We spent pretty much most of the night in the operating room. We had a blast injury, multiple blast injuries, but the worst case was probably what sounds like an Apache helicopter. Two young children brought in dead, one probably 4 and 5 years of age. And then we had a girl, 11 years of age, with severe lower limb injuries and upper limb injuries from bullets from an Apache helicopter. Extremely unwell. We repaired her brachial artery. She's a very high chance of losing both lower limbs because of the soft tissue and fractures. Soft tissue loss and fractures, and also the soft tissue loss and fractures of her upper limb. So 11 years of age, and her dad came in with severe injuries as well. He died during the night. Her mom, I believe, is still alive. So that is the reality of what we're dealing with.
Victoria spoke to Morgan McMonagle yesterday. He volunteered in Gaza with medical aid for Palestine. And again, I must warn you that this interview contains distressing details from the start. Vic began by asking Morgan McMonagle for an update on the health of the young boy in his video diary.
Well, when I left, I'm back 6 days now, and he was doing well. He was the first patient that we operated on when the ceasefire was breached on the early hours of Tuesday, the 18th of March. He was one of the few patients in the first wave that arrived who had severe injuries. He was very quiet. Sick, injured children who are quiet are always more concerning than children who are crying or screaming, because a quiet child is an unwell child. We did spend the first 20 minutes pronouncing people dead, of which most of them were children. Many of the adult dead were brought straight to the mortuary, especially the men, but a lot of the women and children were brought straight into us. Once we got through that first wave, we were treating him on the same trolley as 2 other children, so one bed for 3 kids who were all critically injured. And eventually someone had to make a decision that we need to start operating. So I picked him up and ran up 4 flights of stairs to the operating room. I didn't trust the elevators after, because there was bombings going on. I didn't want to get stuck in an elevator with a dying child. He had his abdomen open, he had some bleeding in there. That was taken care of, and he had a popliteal injury, which is the main vessel behind your leg, which was repaired. in a 5-year-old child with no microsurgical equipment. You saw in the video the foot was doing well and I was very pleased, but he also has a lot of other damage, including bone and muscle and nerve. So there's still a high risk that he will end up losing that leg. But when I was leaving, he was starting to behave at least like a normal child. He was complaining and giving out. I met his dad, who gave full permission to use the video. His mom was injured. I think she may have lost an eye, I'm not entirely certain. And he had 2, if not 3 siblings also dead.
And we heard you ask, are his parents alive?
Yes.
And I wonder how many times you might have asked that question when you're treating a child in the period of time you were working in that hospital.
Yeah, and most of the time there was at least one parent dead or severely injured. There was a child in the bed next to him who was the second child I operated on, who was also still alive and doing well when I left. And I think she was about the same age. She was about 5 or 6. She had a kidney injury, liver injury, and we took her spleen out and some bowel injury. And that's what shrapnel does. It is very high velocity, sharp metal flying in all directions, and it's thousands of pieces. But we discovered after we woke her up from the ventilator 2 days later, she had a piece of shrapnel in the left side of her brain. So she was completely paralysed down the right side of her body. We had another child who was 1 year old who had some shrapnel injury to the belly. And when that child woke up, he was calling for his mom, but his mom was dead. Youngest child he operated on was about 4 or 5 months. And I'd say the average age was between maybe 8 and 14.
From the moment the ceasefire broke down, March the 18th, you worked for something like 20 hours non-stop. In the first 20 minutes or so, you've already said, you pronounced many children dead. Do you know how many? Can you recall?
There was 5 or 6 NGO members all doing the same job, and there was the Palestinian doctors and nurses there as well. I would say in the first 20 minutes, I personally pronounced probably between 8 and 12 dead.
All children?
Children and women.
Right.
There was a handful of men, but I did go to the mortuary next day briefly, and I'd been to the mortuary before. There's 2 rooms in the mortuary that can hold 25 bodies each. They were both full, including bodies in the floor, so that's at least 60, 70 bodies. And then in the floor of the mortuary was lots of other body parts. So it's really hard to count really how many were horrifically killed. Many unrecognisable, so they'll never be claimed. Or even if they are recognisable, often family members are dead as well, and they'll just get put in a mass grave unmarked. And that's the reality, and children included. But I did notice when things settled down, around about lunchtime, shortly in the afternoon, when I left the operating room, got a drink of water, I walked through the intensive care unit. It's a 20-bed intensive care unit. Every single bed was full. I went back about 7 or 8 in the evening, because that's the time they break their fast, so I went to get something to eat. The intensive care unit was only half full, because they'd all died. And that's the reality when you're dealing with a mass casualty situation.
Now, you are talking about this in really matter-of-fact terms.
Yep.
What you are describing is unbelievably distressing.
Yeah.
Obviously, it's your job. I totally get that. That's why you went out there to help. But how do you process what you saw? So when something like that happens, you kind of click into that professional mode where you have to get the job done and you want to do the very best for the greatest number. And like I said, I had experience at St Mary's Hospital during Grenfell, Westminster Bridge, London Bridge. I worked in Selly Oak, Queen Elizabeth Hospital in Birmingham in the military wing at the height of the last Iraq war, when a lot of young men, servicemen, were coming back with horrific injuries. But this by far was the worst. You know, I worked in a big urban centre in North America where we saw 8 to 10 gunshots a night, but nothing compared to this, because of the sheer, not just the sheer scale of it, but really the numbers of children who are severely injured, and I mean really severely injured. That is 100% man-made. I don't mean mankind, I mean man-made, and it really is. And some people get very upset. Most people in humanitarian work in a conflict zone can process their own anxiety and upsetness. It's not a proper word, but you know what I mean. And we'll often discuss it with the team later. But I have to say, when things finally calmed down, I felt a lot of anger.
I felt a lot of anger because it's fully preventable. I felt a certain amount of anger that I allowed myself to be put in a position where I had to take care of extremely sick children who should never have been that sick. And then later, that gave way to guilt. Some of the Palestinian doctors are really, really tremendous, doing a tremendous job. And during the height of the conflict, they were dealing with this every single night. And you could see it. You could see how they clicked into action. So I felt a lot of guilt when I was leaving. And I mean, I'm not afraid to say it. I'm a white Caucasian male from the Western world. The luxury and the elitism that I can leave, that there are forces out there at government level and NGO level that will get me out.
Sure. But
I'm leaving some very sick patients behind in a zone that's going to happen again, and colleagues that are going to deal with it again and again.
On the night when the hospital you were working in was hit, it is a fact, and I'm just letting our audience know this, that among the dead that night, according to Hamas, was a senior Hamas leader. They say he was being treated there. The IDF say that is false. He was there for terrorism acts. When the hospital was hit, presumably you spring into action. You're not thinking about your own survival.
Well, we were on the 4th floor. Most of our activities are on the 4th floor of the hospital, which is the top level. So we had our accommodation, the intensive care unit and the operating rooms, all on the one floor. The 2nd floor was hit, the male ward. It was a ward that I was on every single day, doing rounds, seeing patients, doing follow-ups. In fact, I had planned to go down to that ward later that night to see, I'd repaired a brachial artery in a gunshot wound earlier that same day. And I usually like to see those before I go to bed, just to helps me sleep.
So you could have been killed?
Potentially, and I'm actually amazed no staff were killed. I really am amazed. We see the destruction inside the ward. And I'm not a ballistics expert, but as far as blasts go, it's small compared to some of the buildings that are collapsed. But, you know, it killed the target and one other 16-year-old boy who we had operated on 2 days before. And the only reason why I probably wasn't there was because we were in the intensive care unit. We had 2 sick patients who needed to go back for bleeding to the operating room, and we were trying to decide which one to go first when we heard the blast. We didn't, at first I thought it was a blast outside, and then within about 2 minutes, our security people said, no, the hospital has been hit. So you do wonder, are we now a target? It took about 20 minutes for information to come through that it was a targeted hit and that the hospital wasn't the intention per se. But we all know that it is against the rules of war and all humanitarian codes of practice and conduct and the Rome Statute of 1998 that you do not target healthcare or healthcare facilities. But it is happening, and it's not just happening in the Gaza war, it's happening in other wars around the world.
Of the many patients you treated, who stays in your mind?
That little boy, because he is a success story, and I hope he keeps his legs, I really do, and I'm keeping in contact with some of the doctors looking after him. MSF are running the limb reconstruction unit there at the moment, so I'm keeping in contact with them. The 5-year-old who I had to open the chest and abdomen without a scalpel handle stands out because I've never, despite having managed horrific injuries across the board, mostly in adults, I've never had to do that in a child before. And although the child was alive at the end of surgery, died about 8 hours later. So that child will always stand out.
Thank you for being with us. Thank you for talking to us and to our audience. Dr. McMonagle, thank you.
Thank you.